Good morning, everybody. Thank you so much for joining us. As you might see, this doesn't happen every day, but both of our hosts are actually out. Heather Stricker is doing a great shoot for us out at the air show. And of course, as you may know, Tina Jennings is getting ready for her big wedding this weekend. So we have Zach Clark from the ESPN Tucson. Thanks so much for joining us.
It's always good to be with you guys. Love coming back and doing this. And for those of you out there, if you're not happy with your smile, but you thought maybe if you go in and didn't get it fixed when you were a kid, it's just too late. But Alex, guess what? That's not true.
Absolutely. And actually, Dr. Kirk Kaser from Ortho Pros is here to tell us all about it. Doctor, thank you so much for joining us.
Thank you for having me.
So most people think of braces as being for kids, but that's simply not the truth. I mean, adults can actually get treatment too, right?
Yeah. A lot of adults actually are starting to get treatment, and those numbers are increasing. So right now, I think it's about, our practice is about 30% adults, but that's increased a lot over the last few years. It's becoming more popular, and there's a lot of different options for them as well, too.
And that's sort of what makes the difference, right? Is they can have different ways of adding braces to their teeth that maybe don't look so obvious.
Yeah. And before, traditionally, it's always been the metal braces. Used to be metal bands as well, when a lot of them had them before. But Invisalign's come about, clear aligner therapy, and then also clear brackets as well, too, that really make it that adults really like. And a lot of teenagers, too, but the adults are really popular with that.
You mentioned the metal bands. I had braces when I was a kid, and I remember going through all that. But what about me now, 20 years later? Will that benefit me to come back and have that done again?
Yeah, it really will, and a lot of it's more health and function as people get older and as adults come in for treatment. There's still the aesthetic part of getting them to look nice, but a lot of times being able to help clean the teeth easier and also wear on the teeth from forces and misalignment of the teeth, getting those corrected really helps the long-term health and maintaining that.
Right, and we were talking a little bit before the show, and we were saying, well, me personally, I had braces. I don't really wear my retainer anymore, but teeth shifting is a real thing.
Yeah.
And so you treat adults for that too as well?
Yes, yeah, and everybody's teeth shift throughout life, so the retainer is actually what holds them. So if somebody stops wearing their retainers, the teeth will eventually shift. It varies, from individual to individual, but we get a lot of people who have had braces before as a teenager, and then late 20s, early 30s, even into the 40s, that come back, and Invisalign's a great option for that. They don't want the braces again, but they want some correction.
And Doctor, you mentioned some of the health advantages. I think normally people think of it as just an aesthetic thing. They want to look better, but how serious could some of those problems be for adults down the road?
Yeah, and just maintenance and bone level and keeping the teeth healthy, that's the biggest thing that I see. As they start to crowd, it becomes harder to clean the teeth as well, to get floss in there and to brush properly, and then also the wear. So there's a lot of dental issues that can result from malocclusion and misalignment and crookedness of the teeth.
Right, and the fact is here that you're just never too old for braces, right?
Yeah.
So how many, do you have an estimate of how many adults you treat?
We treat a lot, I think 30% probably in our practice, right? Which is a good number. Numbers-wise, I'm not quite sure, but that number is definitely increasing over the last few years as well, too.
And it sounds like you're seeing a change. There's almost a stigma that comes with adult braces. It sounds like you're seeing a change in that, too.
Yeah, it's becoming more acceptable, and I think a lot of it is the different options that they have, right? They're not as noticeable. So a lot of people, even besides Invisalign, the clear brackets that can go on the top, most people just don't notice it. And so once they get that on, they realize that they're really happy going through the process. They don't know the options until they come in, and we can explain that to them, but they're really happy with it.
Well, I think a big deterrent factor maybe in the past for people too has been the cost of it, but you guys actually make that accessible to everybody. Can you tell us how you do that?
Yeah, and we're really proud of our flexible financing and low down payments as well. We really want everybody to be able to afford braces from that sense. We work really well with people, and that's opened up a lot of doors for people that didn't think they could afford it before.
Great point.
How do braces in the adult sense, maybe the Invisalign and the clear brackets, how does that impact your everyday life? Again, remember when I was a kid, I couldn't chew gum. There are things that I couldn't do. How do those adult versions impact the way people live their lives?
Yeah, I think Invisalign's been the biggest change for that, because it isn't braces, it's clear aligners that go over, and a lot of people don't notice a difference from their daily life. There's a lot of people who are worried they may do public speaking, or they may do a lot of lectures and presentations, and they're worried about it, but they come back the first time and say, it just wasn't a big deal at all. I'm used to it now, and this is fantastic.
Well, and that's one end of the spectrum, is basically invisible braces. Now, if you really are, say, a Wildcat fan, you can get something, especially at Ortho Pros, right?
Yes, so we have the Block A braces, the Wildcat braces. They're fantastic. They're the Block A. They go on the two front teeth. Kids love them. We've partnered with the U of A specifically for that in getting those braces in. It's been a great thing for us. It brings a lot of fun to the practice.
I think they're so cool.
Yeah, I mean, that's what I was saying earlier. When I was younger, the coolest thing was just those little colored bands, but you guys have blown that out of the water.
Yeah, we try to. We try to keep it fun.
And I'm sure they can alternate blue and red anyway,
Yes,
can't they?
yeah. And you can even put footballs and basketballs onto the side of the block A braces.
So
as
you
well,
really
too.
have, no matter if you're young, old, somewhere in between, you guys got something for everybody.
Yes, yep.
Technology. So before we go, we have just a little bit of time left. Is there anything else that you sort of want to leave our viewers with?
No, just like you're saying, you're never too old to have braces, right? And the different options that we have, we try to make it fun. We try to present different options for everybody, and our financing as well too. Really trying to make it affordable for everybody.
Well, Dr. Kurt Kaser, I mean, I've had a great experience at Ortho Pros, and people there are so nice and so welcoming, and you just feel comfortable going there. So people really need to check it out. And I want to thank you so much for coming onto the Blend as always, and telling us all about the great technologies that you have now for teeth.
Thank you. I appreciate that. Those are really kind words.
Of course. Thank you.
Especially when you can stretch it out over young, old, and everybody in between. Ortho Pros offers free braces for $99 a month. Also available are Invisalign, traditional braces, and Block A braces. For more details, you can call 290-8787 or visit orthoprostucson.com.